Good morning today, 27th August 2024. We are going to discuss editorials of The Hindu. All articles published today, they are talking about women's safety, against violence against women. Recently, you might have seen there was a doctor in Kolkata, she was attacked and then she was, even death also happened. Regarding to that case, many articles has been published. So we'll discuss three articles. Those things talks about women's safety. First article here, crime, health worker safety and self-examination. What are the things we need to learn from the previous past learnings? This article discusses about crime, even health worker safety also. In 2017, there were several protests by resident doctor in Maharashtra. Even there were a series of cyclic attacks on medical personnel in rather happening in quick succession. These cases are sensationalized criminal offenses. Despite the higher is the magnitude of the problem, the solution was straightforward. The solution was to strengthening security in public hospitals, even strengthening legal instruments to bring the malefactors, those who are creating issues, they should be brought to justice, and then justice should be given to victims at the rapid pace. Similar incidents they came and they have gone with much happening during COVID-19 pandemic also. You might have seen how healthcare workers worked across 24/7 for people during COVID-19. However, they were attacked by people because they were spreading pandemic. There was even fallacy was going inside the several community. These responses even keep on continuing. So all these things, they ask only one question, which is very evidently visible. The swift justice, quick justice should be brought, and then action should be taken at immediate level. We need to think the problem, in deep manner. Recently, there was a death of student doctor in Kolkata. Even that has taken country by storm, and then Supreme Court sumoto taken the action because state government was not taking any action. But this emergence answers to this issue continues to be remain reflexive. This coming even simplistic. This possibly reflect incomplete understanding of the issues underneath. We did not understand the issue from the bottom. Supreme Court has taken the case, but Supreme Court on 20th gave judgment regarding constitution of National Task Force. What they will do, they have to study strengthening of hospital safety. They told improved infrastructure, closed circuit television surveillance, greater security presence at hospital, even safe night transport. There are repeatedly some areas where Supreme Court pressed, and then this receives a great attention also. In the same page, government of West Bengal, they announced Ratrir Sathi, means night companion program. What it will do, it improves the safety of women working at night shift, particularly those female doctors who are working in medical colleges and hospital also. But such initiatives are very critical. They basically increase the complexity because these healthcare violence are they are old types. These are initiated by several issues. There are like those patients who are angry against poor healthcare services. Even women's safety at large, these kind of issues keep penetrating. What underneath, what is below is more dangerous problem associated with corruption of criminal proportion. The author says corruption is the main issue that is happening under whatever the issues. So Supreme Court gave up all these things. These are the small issue. The big problem is the corruption. This conventional answers to healthcare violence, improving hospital security, new legislation, they have miserably failed in tackling problem over years. Why? Because these initiatives included underfunding, or they haven't impacted healthcare systems in general. But the extent which the corruption contributes to overall loss of lives, this has been grossly and vastly underappreciated. If emerging accounts are anything to go by, there is a strong likelihood this deep rooted organized corruption this has contributed to dangerous crime in question, not to mention other incidents and steady erosion of these public healthcare services that have gone, like unaddressed. This fact remains even highest healthcare institution because they are already underfunded state healthcare institution. This is also deep concerning issue. According to World Health Organization, it estimated that corruption claims nearly 455 billion annually worldwide. This is more than what it would cost extend universal health coverage to all. We have discussed several articles about universal health coverage. So we need more than 455 billion dollars across global to implement this universal health coverage. What it will do? It will provide healthcare services to all at affordable cost, even at low cost also. Good part of this developing world, corruptions is like what majorly contributes to healthcare crisis, even poor health outcomes also. While these issues has been sensationalized, the disclosure of medical corruption in India is largely concentrated on private losses, maladministration, but criminal dimensions have been largely underappreciated or they have been gone unnoticed. Human resource intensive healthcare systems provide rapid breeding ground for expansionary corruptions. They include a worst form of sextortion, particularly political system where underfunding and poor oversight run this kind of risk. In such scenarios, it is hard to understand how much help would realistically help merely accruing state of health workers security, hospital infrastructure, even if they somehow adequately implemented. Even if you implement these measures, they cannot much help the people. Being galvanized to fact that medical corruptions can claim lives of the healthcare workers, they also patient serves to indicate that public healthcare and then these drivers may be they require rigorous self-examination. Speedy delivery of justice in Kolkata case is very important, but it should serve as a deterrent. This means it should make someone to feel it is wrong to do thing, and it should create deterrence. In my opinion, there should be a capital punishment based upon crime proportion. Those who perpetrate violence against women should be forced to capital punishment. This will be only solution. I think this will reduce crime against women. There are several steps that are need to be taken. This national task force, this job is very important, very monumental. Instead of simply recommending safety measures such as they should understand this medical corruption, especially in the public sector in deep driven manner. Certainly, this cannot be approached by just medical doctors. This requires opinion from public health, medical and legal personnel, even other allied competencies, such as meriting participation and sanction of the larger government and administrative community. Then the strategies should be placed. They have to be much looking beyond this instituting yet this novel legislative tool. They have to look beyond this legislative actions. Apart from there should be reforms that should focus on administrative transparency, accountability, and even oversight also. Effective whistleblower reporting and protection mechanisms, thorough digitalization of public management system, they are very crucial. The need for ombudsmanship and even other instrument to minimize political intrusion, and these things cannot be understated. This should be understood. Inspiration can be drawn from Brazil government. How they have battled political corruptions in medical field. There is a much also remains to be done in way of modernizing control and command of Indian public hospital. This public hospital need to be controlled and command. There should be a proper mechanism. They are following the old ways. These old ways will not solve the problem. Efficiency always remains issue at these hospitals, but there is always a high pressing need for even moral and regulatory basis that present today and cannot be overlooked. All these issues should be controlled. This is the article about crime, healthcare safety, and self examination. The next article, fear and vigilance of the women. This article also discusses about women's safety in greater detail. The same thing article discusses. There was a rape and murder of women doctor in Kolkata. This led country to think about safety of women in India. Women across country, they face several problems. Those problems highly visible, such as sexual harassment, dowry related deaths, even rape, and not to mention domestic violence also. Physical impact of violence that can be visibly seen against women, these are acknowledged by state and society because they are visible, and then they start protesting against such an issue. But one focus area where we need constant attention is psychological and behavioral consequences. This means physical and explicit acts of violence. This will provoke immediate and visible responses from our civil society. But when it comes to psychological impact, this is difficult to measure. Even this go unnoticed and unaddressed. You see, in domestic violence, verbal abuse happens on women. So those women cannot face and cannot discuss those things, and then this will become a huge issue. You cannot even identify in society also. Even if you take this, these issues are already ingrained in the state. In the absence of adequate structural protection by the state, even in the society, the ownership of one's safety falls on women themselves. Women in India particularly, they are forced to live in perpetual vigilance. They have to look after themselves. They should constantly evaluate their surroundings for potential threats in public and private spaces. The state of this constant vigilance, deeply ingrained in the psyche of women, this learnt and imbibed from very young age. They are being taught from their mothers. Then this becomes necessary and exhausting also. Why? Because India is becoming highly unsafe for women. What makes situation even more troubling is that vigilant state has become deeply embedded in daily life. It is even perceived to be norm. It has become a norm to the extent because women often find trouble to find the language to articulate the discomfort, even mental labor it causes to women. Women become used to living in this heightened state of awareness, and psychological strain it creates often goes unrecognized, even by themselves, even by the society also. This burden highly shapes how women interact with the world, even perceive themselves and engage with the society. This constant need to think and wait for potential threats curtails women freedom and explore new places, take new risks, and even connect with others also. This even avoids women from simple pleasures, leisurely observation, spatial connection, even ability to spend time in the moment. These issues even impact women career choices, even to personal relationship also. Many women, they decline their job opportunity because this require late night travels. Even these women hesitate to move to new places, without ensuring a strong support system. The simple, pleasurely, leisurely walk in the park also, this is constantly they will be thinking potential threats, how it creates in the park. These decisions, these can be significantly restrict their personal, material, and then psychological growth also. There are also intergenerational effects as this burden is often passed on from mother to daughter. Daughter always taught to be cautious and adjust her behavior to stay safe according to the society. These things strengthens the idea. Individual women are responsible for their own safety rather than society taking collective actions to create safer environments. As a result of this, women are expected to adapt their behavior. The protective measures imposed by families, communities, this will restrict women movement and freedom, and then it will become violence. The vigilance also creates a strong dissonance, a mental disconnection between how women want to live and then how they wish to live. Author says, as a woman and teacher, she always find herself finding these kind of conflicts daily. She encourages her female student to be brave, challenging, patriarchal limitation and to live freely. However, she told she find herself in male family member company, even ask friend to accompany her in late night trip. For example, even choice that feels odd to empowerment, she advocate. Women are frequently forced to navigate this duality. Even if you take, disadvantaged community, those women who come from marginalized community, low social hierarchy in India, they have to bear the brunt of all these issues. In addition to these safety concerns, they have to face new threat of religious, caste, class, even religious issues, adding burden to safety of the women. What about the impact of the society? Women are forced to prioritize safety over curiosity, even vigilance over exploration. They are denied this full spectrum of human experience. The world then becomes one of the danger and caution. These things, what it will do, it will limit their experiences, but also they deprive society of the contributions and innovation that could have flourished if women were free from this constant burden. You might have seen Helen Keller, how she has contributed to the society. Even Madame Curie also. If they are living in such a free society, they can contribute to development of the social issues also. Even unseen and unspoken burdens of women they carry, emotional strain, psychological fatigue, loss of joy, freedom, they are significant. Even they are more significant than physical injury. Recognizing and addressing this burden is very, very important for building more equitable society where women are not only safe but also free to live without constant shadow of fear. The challenge to this requires, fundamental shift how we think about the society and violence. In a society that often equates violence against women solely with visible physical harm, it is crucial to broaden our understanding to include, this physical violence, mental violence also. We need to consider them also. Women should not be chosen between their safety and freedom. State and societal measures, they should not restrict women freedom any further under guise of ensuring safety. Author says these issues need to be considered in detail. State government and civil society, they have to work for safety of the women. Then only we can build equitable society. Next article about rethinking violence in healthcare. This article also more or less about the similar space. This is about the women healthcare aspect. According to World Health Organization, what is violence? World Health Organization says intentional use of physical force, power, threatened or actual against oneself, another person, or against group of community that will result in death, psychological harm, in a maldevelopment and deprivation. What is healthcare setting? This is basically services, interactions, and places where healthcare occurs. Author says over the past 4 years, Association for Socially Applicable Research, they have been working on the research and advocacy related to violence against healthcare workers. This is called ASAR. They have come about one online petition with the central government. They requested state government to pass this bill, Healthcare Services Personnel and Clinical Establishment Bill 2019, along with implementation of other state laws. This petition, this has received almost 1,70,000 endorsement. You can understand the gravity of the situation. How they see violence? Author says we need to think violence from different point of view, such as physical spaces such as hospital wards also. Asha worker, you might be knowing, accredited social health activist, they goes to village, they face a lot of issues. Basically, author talks about there are several issues we are facing in the society. There are patriarchal issue. There are healthcare workers who are working in the downstream area, such as Asha worker, midwives, even Anganwadi workers also. Sometimes they face physical violence from the fellow society and fellow human beings. Suppose the Asha worker belonging to downtrodden community such as SC, ST, they have to bear the brunt of violence. Violence against healthcare workers is one area where we have discussed, but violence against those workers, even those people who are seeking medical attention is also great to mention. Those people who can afford, those who belonging to upper caste, those who are financially well, they can go to private institutions where they can get good medical attention, and then also they will face less violence. When it comes to poor people, where they have to afford to government hospital, they have to bear the brunt of violence every day. Sometimes caste abuse may happen, sometimes physical abuse happens, even verbal abuse happens, because these people demand healthcare, but such a healthcare services are not available. Even healthcare personnel who are working in the hospital, they basically belonging to upper caste, they will resort to such a measures when it comes to violence against these people. When you add additional factor, you bring women into picture, and she is from the marginalized community, she has to face a lot of issues. Even those who are working in shift, even night times, they have to face a lot of issues. Newly newly recruited doctors, even newly recruited patients, both doctors and patients, they will face sexual abuse from the fellow doctors and fellow human beings. These issues need constant attention. Author brings one example from Taiwan. Taiwan in 2017 they brought one law to protect healthcare workers, even the rights of the patients also. According to this law, if anyone causing harm to patient, they will be liable to pay fine up to 70,000 to 1,30,000. Even they are punishable up to 7 lakh rupees, imprisonment up to 3 years if they are, the patient or doctor supposed to be died. This violence is a very small problem. It cannot be, like it is understood from different point of view. It is real, and it is very unequivocal that healthcare spaces, they are the places for healing. There should not be any tolerance of such kind of violence that will result in counterproductive measures. There is an end goal of the hospital sector to solve social problems. There should be strong formulation and implementation of policies, even laws that will protect everyone from healthcare spaces. That will starting point where it happens. Today we discussed 3 articles basically related to women's safety. Thank you very much for the discussion.